It may feel like pandemic deja vu because new COVID variants are already circulating and cases are on the rise again. Earlier this month, we told you about the EG5 or Eris, if I'm saying that right. It's the most prevalent COVID variant going around right now. And health experts say they're keeping a close eye on yet another type of COVID, which could potentially be better at causing breakthrough infections, meaning if you're inoculated, you can still get sick. Fox 13 health reporter Mandy Rock talked with health experts about what they're seeing here in the Mid-South.
It's called BA.2.86. Although so far there has only been a handful of cases, the doctors I spoke with said it has many more mutations and may be more capable of causing infections in people who previously contracted the virus or have been vaccinated.
One of my classmates, she just got over it just recently, so it's still out there.
As summer winds down, COVID cases rise, pointing to a possible late summer surge once again.
This summer, we've seen a significant uptick in cases. We've seen a 10 to 15% uptick in cases every single summer of this pandemic.
Right now, the Omicron subvariant EG.5 or Eris is the dominant strain of the virus. Although overall infections remain much lower compared to the past, CDC data shows for the week ending August 12th, hospitalizations rose 22% from the previous week. Dr. Threlkeld, an infectious disease specialist with Baptist Memorial Healthcare, said Eris is similar to past Omicron subvariants and presents similar symptoms. But a brand new variant called BA.2.86 is starting to circulate and appears to be much different than previous strains.
We don't know whether it's more severe. We don't know how much more contagious it will be. But anytime you see a lot of changes in the surface of a protein of a pathogen or virus, you're going to have the immune system have to catch up a bit.
Though it's unknown whether the new variant will cause more severe disease. Dr. Shirin Mazumdar, an infectious disease specialist for Methodist Le Bonheur Healthcare, said it's best to take precautions.
Certainly, if somebody is high risk, if they're immunocompromised, if they're at a certain age, for instance, if they're older, or even if they live with a high-risk individual, they may want to consider wearing a mask in high-risk settings, which would be a crowded setting with poor ventilation.
And if you test positive for COVID, the CDC recommendations remain the same. Stay at home for at least 5 days and isolate from others in your home. The new COVID booster, which is designed to target Omicron subvariants, is expected to be available sometime this fall. Mandy Rock, Fox 13 News.
You know, we're getting closer to